older you get, the more likely you are to be diagnosed with scoliosis. You see, most people think about scoliosis with children and teenagers, but only about 3% of teenagers get diagnosed with scoliosis. But once we hit 40 years old, about 9% of adults get diagnosed with scoliosis. When we look at 60-year-olds, about 38% of adults get diagnosed with scoliosis. And when we look at 90-year-olds, research shows that anywhere from 50 up to 68% of older adults up towards the age of 90 get diagnosed with scoliosis. Now, if you're an adult out there and you have scoliosis and you're watching this and you're trying to figure out what to do with your scoliosis, I'm going to encourage you to click on the link below, request a free discovery call, and that will give you a chance to talk to me one-on-one about your scoliosis and what could be potentially done for it. So you may be wondering, well, what actually causes scoliosis in adults? Now, there are actually different potential causes of scoliosis in adults. One, you could have someone that had a scoliosis when they were younger, an adolescent idiopathic scoliosis that they still have present as an adult that may potentially be progressing and getting more severe in adulthood. Two, you may have someone that develops a new scoliosis as an adult. This is called an adult degenerative de novo scoliosis. So de novo meaning a new scoliosis. And three, you could have someone that develops scoliosis that's secondary to some other health-related problem. It could be secondary to a neurodegenerative disease like Parkinson's disease or Alzheimer's. It could be secondary to a trauma or maybe post-surgery, post-fusion from adjacent segment disease. It could also be secondary to something like an anatomical short leg or a sacral obliquity, which basically means an unleveling of the sacrum. But the two most common types in adults, and the types we're going to focus on today, are adults that had scoliosis when they were younger. We call this an adult with an adolescent idiopathic scoliosis, or an adult with the degenerative de novo scoliosis, or a new scoliosis that actually develops as an adult. Now, let's take a look at a graph that actually shows you how scoliosis rates change over time. So this is a really great graph that demonstrates the natural history of scoliosis. As I mentioned, most people think about scoliosis in teenagers. These are idiopathic scoliosis. This type of scoliosis actually develops from the spine growing asymmetrically, especially during growth spurts. Now, some people believe that scoliosis curves do not progress when they're done growing unless they're very severe. But we know curves over 30 degrees have an increased likelihood of progressing even when someone is done growing. But these tend to progress gradually during younger adult years. But as we hit 40 and beyond, especially when we hit about 50 years of age, the rate of progression tends to increase, especially in women with the onset of menopause. And then the older we get, the curves tend to progress faster and faster. Now, when we think about a new scoliosis that develops in an adult or that de novo scoliosis, these typically develop in women with the onset of menopause. And that could be to change of hormones that leads to change in bone mineral density, like with osteoporosis or osteopenia. Changes in estrogen levels can also impact collagen absorption. Collagen is the primary protein in connective tissues like ligaments. And so as estrogen levels changes, the connective tissues possibly change. And then when we look at men, these degenerative de novo scoliosis typically develop even later on, more around like the mid to late 60s or even around 70 years old. But the older we get, the more likely you are to get scoliosis, and the scoliosis tends to progress faster and faster. So how does the scoliosis actually progress in adulthood? So first of all, you get some kind of asymmetrical loading. So if you had scoliosis when you're younger, you have an asymmetrical deformity. That basically the spine is twisted and rotated. The bones actually grew asymmetrical. That causes asymmetrical loading on the joints. The inside of the curves have more pressure on the outside. That causes asymmetrical degeneration, which causes more asymmetrical deformity, and this goes round and round. Now, a new scoliosis in adulthood can develop similarly. You could have asymmetrical degeneration with part of the disc breaking down of the facet joints. That may be first, or possibly you have some asymmetrical deformity. You could have a change in the normal alignment of the spine from the side, or a decrease in lumbar lordosis or a lumbar kyphosis that may make the spine more unstable, cause asymmetrical loading, which causes asymmetrical degeneration. But basically, you have a misalignment in the spine that causes asymmetrical pressure on different parts of the joints, which causes the spine to break down asymmetrically. And as that progresses, the curve gets worse, the asymmetrical pressure gets worse, and the asymmetrical degeneration gets worse, and it kind of snowballs and goes round and round. Now let me show you a couple different examples of scoliosis advancing in adulthood. So this one right here, this is the person that had an idiopathic scoliosis when they were younger and they still have it as an adult, but it turns into a degenerative scoliosis. This is the person that had a 25-degree right lumbar scoliosis. She had this when she was younger. This is the 54-year-old woman. Here you see her 18 months later, and you can see how this curve has progressed 10 degrees from 25 to 35 over 18 months. But she had this curve when she was younger. It grew asymmetrical, but now it's an asymmetrical degeneration that's progressing. This one is the type of scoliosis that actually developed as an adult. This is a great case because this was actually a 48-year-old nurse who presented to her doctor with back pain. If you look at her x-ray from the front, you really don't see anything abnormal there. If you looked at it real close, you'll notice this vertebrae is a little bit smaller here and a little bit bigger here, but it's pretty hard to pick up. One thing we see on here is there's a loss of the normal lumbar curve from the side, which in my opinion was probably what started this because it makes the spine less stable. This was her 9 years later. Now you can see these vertebrae are starting to reverse. They should be shaped with a nice curve and they're starting to reverse. But you see that scoliosis really progressing. So here we have an asymmetrical alignment because of the curve. You can see there's asymmetrical degeneration. The disc is bigger out here and it's more narrow in here. If we looked at a CT scan, you would see the facet joints are actually starting to break down and decay here. So that's putting more pressure on the inside of the spine. So there's more pressure, so these are going to wear out faster and this is going to progress. Again, it took her 9 years to go from here to here. It only took 2 years to go from here to here. Now, you see there is actually a reversal of a lumbar curve, a lumbar kyphosis. You can see there's more severe asymmetrical loading and degeneration. There's also some pretty big instabilities down here where the bone is actually hanging off the other bone. And then they go from here to here was 1 year. So you see this speeding up and developing faster and faster over time. So that's two examples of scoliosis, one that someone had when they were younger that's progressing and advancing as an adult. Then you have the new one that actually develops in adulthood. But what does scoliosis actually look like in adults? What are some of the big physical signs and symptoms in adults? One of the biggest things we see in adults with scoliosis is they typically start to tilt or lean to one side and they eventually start to hunch over. We see their body is out of balance, and this is a compensation from the deformity. And what's interesting, the actual deformity or the bones that are asymmetrical is not where the pain always comes from. A lot of times the pain comes from the compensation from the deformity. Let's take a look. This is what I'm meaning. Here you see the person actually tilting and leaning and collapsing over to the left. This is called coronal balance, and you see the person from the front, they're tilting or leaning forward. So their bodies are typically out of normal balance from both looking at it from the front and back, and then also when viewing it from the side. This is what it looks like on the x-ray. If we drew a line straight up from the center of the pelvis, this is normal. You can see how far the body is shifted over. If we draw a line straight up from the back of the sacrum here, this is part of the pelvis, the upper spine should be here. You can see how much this is translated forward here. Now what's interesting, these are also big predictors of pain and curve progression. When the spine is out of balance by about more than 4 centimeters, either from the front or the side, that's a high predictor of pain and the likelihood of the curve progressing. But when we see these in adults, it's probably the biggest physical appearance or sign we see on the outside. But what about on the inside, and what about symptoms and pain levels? What's interesting, when we look at pain in adults with scoliosis, it tends to be a little bit different than pain in adults without scoliosis. So for example, adults that don't have scoliosis with low back pain, typically that low back pain is in the center and it's symmetrical on both sides. People with scoliosis though, the pain is more likely to be asymmetrical or one-sided. Also, people that do not have scoliosis typically get more of a sciatic pain if they're having radiated symptoms, which is pain, numbness, tingling down the back of the leg. And patients with scoliosis with radicular symptoms typically get pain in the front of the thigh or the side of the thigh. The reason for that is if you do not have scoliosis, it's more likely that the nerves in the very lower 2 segments of the spine are the ones that are irritated. For people that have scoliosis in the lumbar spine, it's typically the nerves that are a little bit higher, more towards the apex or the peak of the curve that are affected, and those nerves control the femoral nerve, which controls the front and the side of the thigh. So adults with scoliosis frequently have pain. It's the #1 motivator or driver to get treatment. Also, that pain is typically on the side of the curve, near the peak of the curve, and if they get radiating symptoms, it's likely to be in the front or the side of the thigh. Now, what about curve progression? Are there things we can look at in adult to predict or to estimate the likelihood of a curve progressing? Now, there are about 9 different signs or predictors that I have put together that help me determine the likelihood of a curve progressing. Now, some curves do not progress when someone is done growing, but many of them do. So let's go through these 9 common signs or symptoms or indicators of the likelihood of a curve from progressing in adulthood. All right, so these are some of the factors that influence the likelihood of a curve progressing in adulthood. First one, as I already mentioned, when you have a coronal or sagittal misalignment greater than 4 centimeters, meaning your spine is shifted off to the side when viewed from the front or back, or from when viewed from the side. 2, when there's a lateral listhesis. A lateral listhesis is one of the vertebrae is shifting or hanging over. You can see that right here. This vertebrae is shifting this way, and the edge of this bone is hanging over this one. That tells us the spine is unstable. The ligaments can no longer support the spine, and it's a high likelihood of a curve progressing. Also, it's a primary indicator for pain. The location of the curve. Curves in the lumbar, the lower spine, or thoracolumbar spine are more likely to continue to progress when someone is done growing compared to curves in the thoracic spine. Sacral obliquity, the bone right here, the sacrum, this is the bone the spine sits on. If the surface is unlevel, the spine is more likely to progress. An anatomical leg length or a short leg can cause a sacral obliquity. Intercrescent line through L5. So if we draw a line from the top of this pelvic bone to this pelvic bone straight over, if that line goes through the L5 vertebrae, that tells us the spine sits higher in the pelvis and it's less stable. Think of someone tall and thin, they're going to be less stable than someone that's short and stocky. If that intercrescent line, like on this one, goes through L4, that does not indicate a higher likelihood of progressing. But if it's through L5, that tells us that spine is more unstable, more likely to progress. The L5 vertebrae not seated well in the pelvis, I was just talking about that in a similar way. The size of the curve. Curve over 30 degrees has an increased likelihood of continuing to progress when someone is done growing. A curve over 50 degrees will pretty much 100% continue to progress without treatment when someone is done growing. The amount of rotation at the apex, so this is the apex or peak of the curve, the more that curve is rotated, the higher the likelihood of a curve continuing to progress. And 9, older age. The older we get, the higher likelihood of developing scoliosis and the higher the likelihood of a curve actually progressing. Now, if you're wanting to learn more about scoliosis in adults, be sure that you click and download our free ebook called Scoliosis Knows No Age Limit. And as I previously mentioned, if you have scoliosis and you're trying to figure out what's the likelihood of your scoliosis progressing or what treatments may be available to you, click on that link below and request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. I'll let you know how severe the scoliosis is, how likely it is to progress, and which treatment options you may be a candidate for, especially if you're looking to avoid surgery. Now, to learn more about the most effective treatment options for adults, especially adults over the age of 50, click on our next video, and I'll see you there.